This is a large literature review on the gastrointestinal tract in regards to COVID-19. As a reminder, the GI tract is quite large, going from the mouth all the way down to the anus. Well, first, you really gotta love a sassy song. Thank you, Mitchell. And I quote, development of relatively effective vaccines, sporadically mandated public health measures, such as masks, increasing herd immunity, moderately effective therapy, and perhaps less virulent. Emerging viral strains have significantly diminished COVID-19 infection severity and mortality, but the pandemic endures, especially in the unvaccinated and vulnerable population. This literature review was last conducted and is up to date as of August 26, 2022. Now, let's start with the pharynx. This is the pharynx. The most common oral pharyngeal involvement is the production of erosions or ulcers, including the loss of smell, loss of taste, or some other taste disorder is commonly involved or occurs with COVID-19 infection, where these symptoms often are the first to appear with COVID infection and are the last to resolve. And in low 1 to 2% of patients, you get geographic tongue disorder, which is something like this, where you get these weird patterns on your tongue. And this has been linked with high expression of ACE2 receptors in the epithelial cells at the back of the tongue especially, possibly leading to injury of the infected papillae. And the papillae are these little bumps on the tongue. On to the esophagus. The esophagus. 90% of people with COVID infection experience gastroesophageal reflux disease, and things that don't work for this are proton pump inhibitors. These actually increase COVID susceptibility and worse outcomes. Famotidine was also proposed, but this shows no therapeutic benefits compared with other H2 receptor antagonist therapies. And while uncommon, these have also been reported in COVID-19 infections. These include achalasia, esophageal necrosis, esophageal rupture, or Bohr-Haave syndrome, and then scleroderma, esophagus, or systemic sclerosis, where we're seeing an increase in cough, raised body temperature and fever, loss of sense of smell, and loss of taste. Moving on to the stomach. The stomach. Common GI symptoms such as nausea or vomiting or abdominal pain may relate to the affinity of abundant ACE2 receptors in the GI tract, including the stomach and duodenum. Upper GI pathology includes stomach ulcers, erosive superficial ulcerative gastroduodenitis, and petechial hemorrhagic gastropathy. Now, gastrointestinal hemorrhage is uncommon, but it does occur, with some studies reporting this in about 13% of hospitalized patients with COVID infection. Clinical presentations include progressive anemia, bloody stool, abdominal pain, and altered vital signs. But the most common finding is actually peptic disease, including gastritis and gastroduodenal erosions and ulcers. Moving on to the small intestine down here. The small intestine has abundant ACE2 receptors, which COVID has been detected in the stool. So this is a large region where the COVID virus can actually adhere or is present. And fecal oral transmission of COVID is likely. So if that's your thing, just be careful, I guess. Now, a big problem with COVID in the small intestine is that it disrupts amino acid absorption with nutritional implications, which means malnutrition, where histologic examination of the small intestine includes small vessel fibrin thrombi, so you're getting those blood clots, submucosal vessels with fibrinous degeneration. So those intestinal walls are sort of falling apart, failing, and then perivascular neutrophil, which is a sign of an inflammatory response in the small intestines. Now, not much appears to happen in the large intestine, but let's move down to the anus. I know, I was pretty surprised too. So in the anus, hemorrhoids are very common in both the general population and COVID-infected patients, where anal fissures seem to occur quite often in COVID infection, with 30% of patients with chronic COVID having this issue. And proctologists actually 50% of their procedures were to remove anal abscesses and or fistulas.